Let's start off by asking you for your name and your job title.
Jeremy Skillington, the CEO of Poolbeg Pharma.
Great. Now, Poolbeg Pharma were organising a really interesting panel on cancer immunotherapy.
Yeah.
Tell us what that was all about.
Yeah, so we had a fantastic guest in Martin Kaiser, who's a clinician in the Royal Marsden. He's dealing with multiple myeloma patients all the time. So importantly, one of Poolbeg's lead assets is POLB 001, where we're treating cytokine release syndrome associated with bispecific antibodies and CAR-Ts that are used to treat multiple myeloma patients. So we've been talking to Martin for a while about these side effects and how we can help mitigate these side effects. So really smart guy, really interesting guy, but on the front line of seeing patients. So he's shared some wonderful perspectives, where the future of multiple myeloma treatments will be and the impact of CRS.
So keeping it simple, why is cancer immunotherapy increasingly relevant as a cancer treatment?
It's been a revelation. The last 5-10 years, adopting your immune system to go after tumors, is a brilliant way to go. I mean, a long time ago, it used to be chemotherapies. These kind of, let's kill tumor cells, but also you killed other cells. Whereas the specificity of cancer immunotherapy is pretty impressive, where you're kind of essentially bringing your immune system close to cancer cells and telling your immune system, let's kill these cancer cells. So it's much kind of cleaner, but as I said, we do have these side effects that we hope to mitigate, but the future is bright for that.
Talking about those side effects, it's called the CRS reaction.
Yeah.
Cytokine release syndrome.
Yes.
How do you sort out cytokine release syndrome?
Yeah, I mean, cytokine release syndrome is one of these kind of newer, kind of evolving. As the cancer immunotherapy is developed, people notice that upwards of 70% of these patients receiving these T-cell engaging therapies develop CRS. And it's difficult. It's challenging for the patients, for the clinicians, for the nurses. They have to have hands-on treatment of these patients. So right now, they use a treatment where they're kind of reacting to develop a CRS, and we believe that we can prevent it from beginning in the first place. So we've got a drug that you can give orally to the patients before they get their cancer immunotherapy, keeps the immune system calm, get the immunotherapy, goes after the tumors, but you don't have this cytokine storm, this cytokine release syndrome. So we believe we can have a major and significant impact.
And this is POLB 001. It's got an opportunity for wider use for immunotherapy, particularly in less specialist settings and earlier stage cancer.
This is the goal.
That could be a big deal.
It's huge. This will be huge. And this is the goal of kind of moving these cancer treatments, out of these specialist cancer clinics into the community hospitals, into community, maybe eventually to GPs. And right now they can't do that because they have to be in this dedicated cancer setting in case CRS develops. Because you need, the people with experience of how to handle CRS to be there. Whereas with POLB 001, if you can obliterate, if you can prevent CRS from happening, you could take the patients, back to their home settings. And I always give the example of patients who live in the country have to come up to the city, they have to stay for a week or two, in these. Why not just stay at home? Take it at home, your cancer. If we can remove CRS from the equation, then I think the actual the treatments the patient will receive will be much easier and, as I say, much more local.
What stage of development is POLB 001 in?
We are just about to go into phase 2A, where we'll be in multiple myeloma patients by the end of the year. And we've had some really good dialogue and discussion with pharma companies who are very eager to see CRS removed from the equation. So we've gotten one of the pharma companies to essentially commit to give us their drug so we can run the clinical trial. I think from that standpoint, that shows great confidence from them that we're on a good roll here. We have a good possibility of eliminating CRS. So they're interested in the data in these patients. So it's going to be patients that are receiving our drug and the bispecifics, to try and manage their multiple myeloma, who we want to see the CRS and how that reacts, and hopefully we don't see any at all.
If we were to look 5 years ahead, where do you think cancer immunotherapy might be?
Well, if I was
That's a big one.
It is a big one. If I was to look 5 years ahead, I would say that POLB 001 in an ideal world is given to all the patients before they receive their cancer immunotherapies. As I said, in their community hospitals or in their GPs or even at home, because we're managing the side effects. And then the patients, as I say, in a much more familiar surrounding. There's been lots of studies about kind of patients and stress, but in your surroundings, you actually can recover. You'd expect to recover better. So we're hoping to see that. So, and these patients are seeing remarkable recoveries. I mean, the cancer immunotherapies, you are seeing essentially cures. And I think what you want to see is these kind of long-term cures, or maybe turning cancer into a chronic disease. So it's kind of managed on a long-term basis rather than having a short-term negative prognosis.
So, this is my final question. The Investor Summit
Yeah.
We put on the first one. Have you enjoyed yourself?
I really have. It's been really good. I mean, having it in August, I think, was kind of a bit of blinding insight. Bringing people together in August, which is usually a quiet month, but the buzz around today has been fantastic. Lots of people standing by our booth, asking us about what we were doing. I think we got very positive responses and reactions from our panel earlier on. Getting a lot of follow-up from there. So congratulations. It's been a fantastic day and looking forward to next year already.
Jeremy Skillington, CEO at Poolbeg Pharma. It's been a pleasure having you at Investor Summit. Thank you so much.
Thank you, Donald.